Hello, my name is Dr. Atlee Wampler, and today I want to talk to you a little bit about how we reverse engineer a compressed or degenerated disc in the lumbar spine. This is a picture of a patient's lumbar spine, and I tell everyone to think about looking at an Oreo cookie, which is two hard cookie crusts and a creamy filling in the middle. Now, although I don't eat Oreos regularly, if I do, I would choose a double stuff because it's that creamy filling in the middle that's the goodie. And in this analogy, that represents the disc height, the spinal vertebra. In this picture, you can see here we have the two individual vertebrae or cookie crust with the creamy filling in the middle. This is a good looking disc segment and spinal segment. And the most important thing is that the disc does not have nerve supply in it, but the height of the disc creates the tunnel that the nerve comes out of as it emanates from the spinal cord. So the reason why we want a nice big disc height in the spinal region is because that will create a nice open tunnel or foramen for the nerve to exit out of without being compressed. But as soon as that disc height diminishes, that tunnel begins to close or stenose. And oftentimes that'll happen for a period of time without any symptoms. But once that tunnel begins to close down and apply pressure to the nerve, you can have a problem not only where the nerve is being compressed, but wherever that nerve goes, you can also have symptoms. These nerves in the low back are the ones that not only control the low back, but they are the ones that go into the buttock and down into the legs and feet. And that's how many of our patients will experience not only low back pain that could be local, but it may radiate into a buttock or into a leg, like sciatica, or even down into the foot and present itself as a peripheral neuropathy. So the important thing to understand is the difference between pain management and regenerative medicine is the actual correction to the structure. You could give this spine all the drugs you could swallow, and you could inject it with numbing agents that would relieve any nerve sensation. But once that medication wears off, the structural problem is still there. So it is a reverse engineering of the structure that is what gets us the best results with patients with these types of problems. If we look at this L5-S1 vertebrae here, we see that the disc is very much diminished in the back, and that the tunnel that the nerve would come out from is very much compressed. And that would be analogous to turning on a hose and stepping on it. Not only would you get a backlog of pressure at the point of compression, but wherever that hose would go, the water would not flow properly and the target would not get watered. And in this analogy, the same thing happens neurologically. Now, this would be a surgical candidate in an orthopedic model. And the question that needs to be asked is this patient a candidate for anything else? And in this instance, the answer is yes. To reverse engineer this, the first thing that has to be applied is what's known as spinal decompression. Spinal decompression is a phenomenal therapy that actually opens up the compressed disc and relieves the pressure off of the nerve supply that not only controls the low back, but that radiates down into the leg and into the foot. The opening up of that disc segment also allows for the tunnel to be opened up and is the mechanics behind relieving the compression off of that nerve. Without spinal decompression, this will only degenerate further to a situation that is no longer regeneratable, but that must be surgically stabilized. Now, we have a lot of patients that go through spinal surgery, and many of them get fantastic results. However, we also have a long list of patients who have had the surgery and still have the symptomology. And the reason why is because if we were to screw and bracket this segment in so that it does not compress anymore, it does not solve the weight-bearing disorder, which is a compression problem. So at the end of the day, to reverse engineer this, we have to open that segment up. And that's where spinal decompression is an invaluable therapy. that changes many lives, including my own, and in this instance would be necessary to get not only relief from the symptoms, but actually the structural changes necessary to make sure that this doesn't reoccur somewhere down the road. Spinal decompression is a very important part of our protocols for helping to get people out of pain who have low back pain or sciatica or even some peripheral neuropathies. And it is a therapy that is very beneficial.